Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. Today's subject matter is not a subject matter that we like to talk about, but we must talk about, and that's end-of-life issues. And we think that it's important because many of you have spoken to us about hospice care and about the effect of terminal illness on the families, and particularly children. So I got experts here. Here it is. I have Dr. Nada Boskovic.
Yes.
How about that? That was pretty good, right?
Very good.
Right. And she is the medical director of Broward Vitas Healthcare. That's V-I-T-A-S, Vitas.
Yes.
Welcome.
Thank you.
Good to have you.
Good to be here.
And doctor.
Not a doctor.
I know. She was kidding me before the show, so but Marla Berger, and you have acronyms after your name. You'll tell us what they are in a second. And she's the program director of Tomorrow's Rainbow. So tell us, Ms. Berger, what are those acronyms stand for?
Absolutely. I'm a licensed mental health counselor. I'm a registered art therapist, and I'm also certified through EGALA and PATH International to provide equine-assisted psychotherapy and learning. And I've done extensive training in play therapy as well.
Well,
so those are some of my credentials.
Well, we're going to get into that because it's very, very important. And I don't know whether you realize that here at Nova Southeastern, we're very involved with some of the areas that you just mentioned.
Absolutely.
But let me start with Dr. Boskovic. The period of time when people end up in hospice care is very traumatic. To obviously the patient, but you offer such wonderful palliative opportunities and reduce pain and suffering, which is really the I would say the mantra of hospice care. But then there are the people who are external to the care that you are giving, and those are some of our viewers who have talked to us about hospice care. So let's generally talk about what is hospice care.
Sure. Hospice care is part of medical care that offers patients the best service when they are at their end of life. That means 6 months or less. We generally give a prognosis. And these are patients who might have a terminal condition, so it varies anywhere from the common things of cancer, heart disease, lung disease. We even include Alzheimer's, and with that there's a whole other, different aspect, or there's a whole other genre of diseases that are included. So these are patients that maybe don't want to come back to the hospital or have living wills, and they state that they'd like to be home, or they just don't want to have any more, in the sense, curative treatments or coming back in the hospital and repetitively staying for prolonged periods of time.
Well, again, you and I spoke before the show, and, for many, many decades, I guess it's before the 1960s, hospice care became a visual and a public recognized opportunity to take care of those people that you just spoke about, dominantly in Great Britain. Explain to the folks what palliative care is and how it's part of the hospice regimen.
Absolutely. Well, all hospice involves palliative care, but palliative care can be for patients who have a chronic condition but not necessarily be at their end of life. So they involve other symptoms. They don't just necessarily have to involve pain. This can also involve psychosocial aspects of somebody's sort of well-being. It can involve other symptoms. So there's a whole different sort of world with the palliative and patients who are not just at their last 6 months. And these are people who might have just gotten diagnosed, or they might have been in the early stages of a certain condition, as I'd mentioned, maybe the Alzheimer's, dementia, or they had a stroke several years ago, but they are declining. So they can receive palliative care.
Okay, so now we're going to talk to you, Ms. Berger. Can I call you Marla?
Yes.
Okay. Tell us how you effectively get involved in the various areas that you're involved in.
So services at Tomorrow's Rainbow actually start prior to death at times, because what we do is we talk with families about how to support children, young children all the way through high school and even young adults, in how to help support them through the death of their loved one. The actual groups that we provide are grief support groups, and they actually start after death. And so all of our services for groups start after death. However, we're in contact with families and providing the most up-to-date information and research on how to support children who are grieving an anticipatory death, as well as children who are grieving the death of their loved one after the death.
And go through, you went through a series of groups or techniques, but give us some insight into some of the techniques.
Absolutely. Well, Tomorrow's Rainbow is based on the Dougy Center model program. The Dougy Center is out of Portland, Oregon, and it's been around for over 30 years. And about 80% of the world's grief support programs are based on the Dougy Center model. The model is really founded in the idea that children don't need to be taught to grieve. They know how. And that if we use their language, which is art and play, then they will be supported in their grief. And so what we do is we provide grief support groups that are age appropriate. We have a 3 to 6-year-old group, a 6 to 12-year-old group, a middle school group, and a high school group. And we also provide the adult support as well. And so by providing age appropriate art and play, including our miniature horse interactions, which vary from age to age, because of course we have to keep it age appropriate. That helps to support a child's play.
And where are the sites, or where does this occur? I mean, you can't go into a home and do individual studies.
No, so our services are located in Coconut Creek on a farm in Coconut Creek, and so we are the only standalone grief support program in serving Broward and Palm Beach at this time, although there's some other agencies that are providing some satellite services as well, in addition to their full-time services. And
what are the, again, I'm trying to get some focus for the viewers.
Absolutely.
How does your program provide these services on the farm in Coconut Creek?
Yeah.
And then what times of the day, or where are they on the weekends or whatever? Because children go to school,
yes.
Parents go to work, etc. So help us out.
Absolutely. So our 3 to 6-year-old group and our 6 to 12-year-old group occur twice a month on a Saturday, and we have either our morning group, which is from 9 to 10:30, or we have our afternoon group from 4:30 to 6. And now just to put another wrinkle on it, one of the things that we try and do is group children by their age, but also by who died and how they died, so they have as many similarities as possible. And so we do have 2 groups, our 3 to 6-year-old group and our 6 to 12-year-old group, that are specific for families who've had a loved one die due to suicide, murder, homicide, substance abuse, overdose, or HIV/AIDS, because their stories are very different than maybe a death from a car accident or a cancer or other illnesses. And so what we do is we really do try and group children. One of the things that we've seen a rise in the past year is sibling deaths as well as drowning deaths. And so we've placed those children as well in the same group so that they have as many similarities with their peers as possible. Also, so our adults can actually talk with each other. Their stories can be very different from one death to the other. Our middle schoolers and high schoolers don't really want their adults around, and so they're actually a drop-off group, and they're Monday evening from 5:30 to 7:30 twice a month. And we serve pizza, we drink sodas, and we do more interactions with our miniature horses, but also our large horse that are more age appropriate with them. For our high schoolers, they're at that stage where they're really talking about their future. So we had a group the other day where we talked about what does their future look like? And this was completely client-led. They brought that up and felt that that's what they really needed to work on. And so they were really struggling with who's going to teach me to drive, who's going to walk me down the aisle, who's going to be there for me, who's going to help me raise my children in the future. Whereas our middle schoolers, they vacillate from being very young one minute to being little adults. And so we've seen them have these really amazing conversations and then need to go play in the sandbox because now they need to regress for a while and go back to some of those younger things. And so that group actually plays around with that need to regress at times after dealing with heavy subjects.
Okay, so now I'm getting back to you, Dr. Boskovic. Mm-hmm. Obviously, you're dealing with the patient.
Yes.
You're dealing with palliative care. and there is then the passing on of the individual. Is there any interaction between your, I mean, I would assume it's really not Vitas's responsibility, but I would assume that just from a medical professional goal, that you often have advice for the remaining members of the family.
Sure.
Let's talk about that.
Absolutely. So there are a lot of support groups that are there. And first of all, when a patient is on hospice, they do have the physician, a nurse, home aide. There's also a social worker and other individuals, volunteers that are part of the program that support these families. And it carries on. There's actually bereavement that carries on for a year after the deceased, but I know that there's been a lot of connections that go well beyond. We also nurture a lot of these charities, so then we do interact together in hopes that these are sort of the links that provide the care that these patients' families need, as you indicated, after they have died. And I thank you for acknowledging all of these aspects of, you know, person's rights to their own care, and that's what's so crucial, and that's where I'm working a lot with the hospitals, with the community, and hopefully giving and providing more education. But I think that's the bottom line, is we want to make sure that that patient's wishes are honored, whether they can speak or not speak. So hopefully they've had a living will, if not that they've appointed somebody as a power of attorney, or that they've designated the surrogate in case they have no family. In some rare cases, then there's guardianship. And so these individuals hopefully will speak for the voice of that individual. Or better yet, if that individual can tell us, that patient can let us know, then we really want to follow what they want to do on an individual basis, day by day, symptom by symptom, and that is so crucial. That's the bottom line, the compassion that's involved and the care that should be dedicated to these patients, and indirectly then to the families. And that is a struggle. That is a very difficult area because some people don't have living wills. And obviously then we can always carry out, because these individuals are cared for at home. We not only have inpatient units, but they can be in nursing homes, ALFs, and various locations. If it's an apartment or condo or their own homes, or living with a child, living with another member of the family, we also take care of those patients throughout the country, throughout this area. So there's sort of a broad spectrum of care that's involved for them, and we hope that their wishes are always met.
After they pass, they have to go on to Marla Berger's area, and hopefully the compassion and the understanding and the training and the values of life can be brought back to the people to understand that the person who has passed with some residual in their life, I would assume. Yes. That they must respect. Am I in the right area, Marla?
Absolutely. One of the things that's so painful for children is that people think, let's just not talk about the dead person or the person who's dying. Let's just pretend everything's fine. Look, the kid looks great. Well, the kid's really thinking, wait a moment, am I crazy? I thought they were really important in my life, and now nobody's talking. They've taken away all the photographs. They've taken away memorabilia. We don't talk about them at the dinner table. There's this empty chair. And they really start to worry about what's wrong with me, that I thought that this person was important, but apparently they're not, because nobody's talking about them. And that's a really difficult thing. Kids, one of the things that they struggle with, especially now that school's about to start, they just want to be like their peers. And now they're feeling abnormal because they don't have someone in their life. Nobody's talking about them. And the person who used to drop them off or pick them up from school is no longer there. Mm-hmm. And they just feel so off. And their whole goal, they just want to feel like they're just like their peers. And so when we don't talk about it, first of all, it doesn't validate that this person lived an amazing life and that they were a really important part of that child's life and that family's life. And so by talking about them, it's so important, memorializing, remembering them, the good, the bad, and the ugly.
Well, life.
Exactly. Remembering their whole life.
There is good, bad, and I don't want to say ugly, because all you beautiful people out there, I never call you ugly. Might be a little funny every once in a while, but not ugly. I want to get back to you, Dr. Boskovic. You got such a beautiful first name, Nada.
Hope.
Hope?
It means hope.
Hope. Well, what better way to end up in palliative care? Because that's a very important word, because I believe, this is just my belief, and I don't like to editorialize, but I believe that the person that's in that state of your care never gives up hope.
I agree. And we don't want them to ever give up hope. In fact, some people say, I actually start living. So we live until the last moment. And that's important to always instill, and I hope that I try to do that with all my patients, or at least to try to make sure that there's always hope. No matter that they've come onto hospice or that they are nearing their end, we always want to give the family and the patient hope.
Well, you got a good first name. Let me ask you this with reference to some of the technical things. Again, the living will gives certain directives or is involved, and I don't think they're impediments personally. I think they're personal life directives that you have to adhere to. Do you find it to be difficult to have certain directives made by the patient long before?
I do when they're not followed. Unfortunately, I've had different instances where a patient's in the hospital intubated and a family states to me that there's a living will in a safety deposit box in another state, and it's a long weekend, holiday weekend, and the patient's wishes states that they don't want to be intubated. So in those cases, yes, if the families unfortunately have that difficulty in accepting this stage of their care, and obviously if they're just not being followed, we have some sitting in the chart and the families again have a very difficult time, or they go through those stages of bereaving well before, so they might exhibit anger, they might exhibit denial, or that they just don't want to believe that you're the one giving them this poor diagnosis, and they want to believe that there is no mortality, and it's a difficult area, and I try to educate, and this has been a big area that I've been trying with the hospitals, with patients as well as the community, to try to educate this aspect of their life and to discuss these stages of their bereaving, and so they might understand better so that they can provide the better care for their loved one should they not have a voice.
Well, again, I always, and again, I'm offering opinion. I usually don't offer any opinions, but I always look at hospice as a means to enable the patient the opportunity to express his or her values in life and to be able to, in quotes, direct the loved ones who are there and are under tremendous emotional and anxiety pressures, not much different than the kids.
Yeah.
And they're having to make decisions that, as you say, sometimes are counter to some of the decisions that the patient made. It makes it pretty difficult, doesn't it?
It sure does. I know that there's been countless situations and interactions with families, so I try to do my best, and I know the whole company tries to do a wonderful job, because then we do have that support team that can come out and provide a follow-up care, and should they come on with the hospice care, they need just to know that we're there to support. And it's not, something that in some instances these patients can come off of the services if they're doing well. So they're not locked into this, as some people feel. It's sort of a myth that hospice, tomorrow they die. It does not mean that. In fact, in some conditions, which is something that I always emphasize when I speak to families, there are some people that live far longer than if they were in the hospital, because elderly patients start getting psychotic, delirium, they get infections, they fall out of bed. So a lot worse things happen to them by them coming back and forth in the hospital. And most of the time they just want to be home. And if they want to be home, we want to be able to care for them at home. And we have the team and the support to do that. And that's a beautiful thing. And so this education, continues.
Well, again, getting back to my statement early on about as my view or my memory of the development of hospice in this nation, when you look at the British model, that was the whole concept. The concept was you know, why don't we allow the patient to die within the environment of their family?
Yes.
Or loved ones.
Yes.
Correct?
It is correct, and
Yeah.
I do think it's a beautiful thing.
Right. So, Marla Berger, we have these kids, right? And they're out there, and tell me your general time in which you are involved with these kids. Is it months? Was it weeks? What is it?
Generally, kids come in. Sometimes it could be before the death, where we start talking to families. And one of the important things to talk about is what, you know, explaining the dying process, as well as what's the funeral or memorial going to look like. And we may never see them again. That might just be that phone call. Other times we have kids come in and that their loved one just died, and maybe the memorial was just a few days before, and they're ready to start our services. Others come many, many years later into our services. Some stay for a few months. We generally ask for a 6-session commitment to come, and one of the reasons is that we know that kids are doing well in their grief around the 6th session. That's just the trend that we've seen. They're really able to verbalize and process some of these things to an age-appropriate level, and their adults notice things trickling out into their regular life at school, the home, friends, and that's a great goal. We want them to continue after 6, of course, because we know that those benefits will just increase, because grief is a lifelong process. So we've had kids who've come in since our inception, over almost 10 years now. In October will be our 10th year. And we have a couple kids who literally were in our first groups back in 2005 and have come, have closed, started back again during their next age and stage, closed, and then come back. And some kids have stayed fairly open almost the entire time. So some kids are months and other kids are years.
If someone is to seek your services, how do they reach you?
They can call our phone number, 954-978-2390. Go onto our website, which is www.tomorrowsrainbow.org.
Repeat the telephone number a little slower. So
954-978-2390.
Got it. Okay.
And they can call us directly and ask us all about how to support their grieving kid. They would fill out a registration packet if they're interested in starting our services, one for each child, and send those in, and then come to a client orientation. We hold them about once a month, sometimes twice, depending on the demand. And then they would be assigned to their group, and the groups meet twice a month, for our younger kids on a Saturday, and for our middle schoolers and high schoolers on a Monday evening.
Is this a not-for-profit organization?
We are, and we
Right.
actually take no federal funding. We survive on private and corporate donations, and we operate with a very modest budget and 3 staff members and over 200 active volunteers.
So what is your email address? Or your...
It is T as in Tom, the word rainbow,
Right.
and then my initials, M as in Mary, A as in Apple, B as in boy, at AOL.com.
Okay, so if anybody wants to give you some money, that's where they do it. We don't raise money in this show, but that's where they go. Thank you.
Wonderful.
Dr. Boskovic, not a hope. I have nothing but praise for hospice care, and Vitas is certainly at at the pinnacle of it. And we have a lot of good hospice organizations, not only in the state of Florida but in the nation. But so I'm so much aware of Vitas' work. You must feel pretty good as a professional that is involved in palliation and care of individuals in not the normal medical state.
I do. I feel very proud, and I feel proud that we can take care of patients, and that I've been able to provide a lot of care that, a lot of these families don't think that we provide. It's so important just to be involved and to say, okay, that we will do blood work, we will do antibiotics, and I think people don't associate hospice with that, so I'm glad that I can provide all these necessary things that can be given to patients at their end of life, during their end of life care.
And I know that your organization is affiliated with certain hospitals, and
Yes.
I guess people can find out about Vitas through that situation,
Yes.
correct?
Absolutely. We're, down in Broward, there are 6 inpatient units. There's obviously the home setting we indicated. There are 3 offices, 2 in Fort Lauderdale, 1 in Miramar, and we're nationwide. So in case there's a family member that wants to go elsewhere in another state, we probably can transfer them.
Mm-hmm. Well, I want to thank both of you. This has not been an easy subject, but like I said, this program is driven by the viewers' questions. And there's been a number of questions, dominantly on hospice, that's what it was, but I thought that we ought to broaden it out a little. And these folks asked a number of questions, and I thought it would be a good opportunity to just talk about it. And I want to thank you, Dr. Nada Boskovic of Vitas, and I want to thank you and all of your colleagues for really the compassion and the fine medical professional skills that you have. I want to thank you very much, and we appreciate it.
Thank you.
And Marla Berger, with a lot of acronyms after your name that I can't figure out what they are, and you already told us what they are. But your organization is in Coconut Creek,
yes.
And you do a terrific job for young people. By the way, at Nova Southeastern, we're affiliated with an equine program.
Absolutely.
I guess you know that, right?
Yes, I'm actually the EGALA networking coordinator for South Florida, so I...
There we are. See, I didn't even know that, folks, and I just found that out. But I mean, it's a very important part of the psychosocial issues related to trauma and death. So we're very much involved, and I want to thank you for all the work that you do, particularly for the kids. Kids suffer, I think, to a great extent, maybe not greater, but to a great extent, a lot more than people know. They just grieve differently than adults, all right?
Yes.
Yeah.
Thank
Correct?
you. Absolutely. They
Right.
do grieve differently,
Yeah.
and that's something that we know, and we try and also educate their family on how to support them.
Well, thank you for being here. We appreciate it.
Thank you.
So, folks, we spoke about a subject that you didn't want to talk about, but you asked us to talk about it, so we did. If you have any questions about hospice care or about the programs that are at tomorrow's Rainbow, just give us a call and you can ask us questions. Here's a telephone number and an email address right here. Remember, this show is your show. It's called Dateline Health. We come to you from Nova Southeastern University. And until next time, my name is Fred Lippman. See ya.